representative, Dr. Rebecca Kiptui, Board of Directors present, the CEOs of various parastatals and semi-autonomous government agencies in our ministry, and their representatives who are present, our most important guests who have served in this country and have retired, whom we are honoring today, our partners, invited guests, and hospital staff, together with our KMTC. Good afternoon. Good afternoon once more. I'm happy to stand before you today in this very important event when we are marking 120 years of existence as Mathari National Teaching and Referral Hospital, having gone through many generations and change of name and serving this country in various capacities, but still the leading hospital in mental health care within the country. And also our end of year staff party, when we do recognize and honor those of us who have worked tirelessly from when we were young people and finally we are exiting service. It is not a small feat to serve this country until we reach the age of retirement. We know that some of us have retired or are about to retire, but for sure we are not tired. I want to take this time and welcome all of us here to this very important event when we are having these dual celebrations. Invited guests, we are more than we are here, but as a hospital, we cannot leave our patients unattended. I want to say that some of us are still taking care of our patients. I will say briefly what we do here in Mathari, basically one or two sentences. In Mathari National Teaching and Referral Hospital, we do have two mandates. One of them is to offer highly specialized mental health services, Madam Chief Guest, and the number two is to offer facilities for training and research. Now, in terms of specialized mental health care, we do one thing: we heal minds, restore lives, and touch families. When one's mind is aching or is painful or has been disturbed, that is our business. In this area, the other thing that we do, when somebody has gotten into a form of addiction, be it behavior, be it use of substances of addiction, those are our clients. It is our business to restore them back to socioeconomic productivity. For us as a hospital, addiction is a known mental condition that requires treatment, and we do it, that is what we do best. In terms of offering facilities for research and training, we do offer this facility here to over 86 institutions that bring their students here for practical attachment or do research, and we are partnered with many other institutions of research, and this is the pioneer institution in mental health research. And it is going to be better as we move on and on. This hospital became a parastatal in the year 2020 August. We are still in the transition. It is taking a bit long to come by, but we are about there. We have a team led by our head of HR. It has done quite a lot of work, and we are nearly there. I know the staff are really waiting for it, but we are nearly there. The hurdles we have crossed many of them, and we are just about there. In terms of medical care, we have made significant progress. Madam CS representative, I'm sure those of us who were here in Mathari a long time ago, our patients, unfortunately, then most of them were walking around naked, and they had significant side effects from the medicines we were using then. but I want to assure all of us and the general public that mental health care has really improved, made tremendous improvement in the way we care for our patients. We have more newer medicines and more modern methods of treatment that when you go to the wards, you will actually ask yourself, where are these patients here? When they were brought, they were really sick, but once we put them in our treatment, you will be surprised that they improve, and you can't see that notion that many people have, that in Mathari the people are basically mad. They portray our nurses like somebody who has a cane managing people who are off. We don't do that. The kind of care we give them is quite humane. We have improved our wards where they stay, the diet we give them, the kind of medicines we give them, and the care is exemplary. And if you have time, this is your first time here, we encourage you to visit around during lunchtime. Just go around and see how they are. You'll be surprised that it is totally different. Whenever people come here, like my friend from Equity and others, they are really surprised. This is the way Mathari is. We are going to be even better. I want to assure you. As a hospital, the biggest room we have is that one of improvement, continuous quality improvement, which we do very easily with my dedicated staff. We ensure that each and every day we are improving in the kind of care that we give our patients. And currently as it is, I want to assure you, all the mental health workers, they want to come and work in Mathari. We advertised for a few posts. We got overwhelming response. We will not be able to take on for psychiatrists. We are having people who are transferring from the counties coming to work with us in Mathari. And people are surprised that we do offer that kind of care, and the work environment is that kind of supportive environment. And I want to tell you, we can only be better. I want to take special recognition of Social Health Authority. We are working with them very closely. You know, there was a transition from MNTRH to SHA. We have made tremendous progress. And I want you to know that our patients, because of their illness, they lack identification document at the time of presentation, and they lack telephones. So registering was quite a bit of challenging. We have crossed that bridge. We are able to register our patients, and they are beneficiaries. As we are talking, they are beneficiaries of Social Health Authority funds. We are working to see how we can also benefit from the emergency critical and chronic illness fund, and we are also working with the SHA management to see that we also benefit from the primary health care fund. As we are aware, access, as you may be aware, Madam CS, access to mental health care in the counties is quite minimal, and some counties don't actually have mental health care. So we are closely working with SHA to ensure that this package for primary mental health care is also available. So far, we have made tremendous gains. My staff who are working in the clinical areas will start seeing us now use SHA. We had to close the hurdle of registering our clients who didn't have identification document. Probably from next week, the working closely with SHA will be using biometric registration, and we will be the first one to use it. So we are making significant progress. We have introduced in the last 2 years newer medications, and you have seen how our patients are doing well. Before we didn't have clinical psychologists and counseling psychologists. Now we have them in the hospital, and they are contributing quite greatly. Like Madam says in the second, I want to tell you that our rehab is 100% all the time. If you are a client, we are admitted, they will queue. We have done a ward to expand those services. We are waiting for funding to employ more workers so that we can open a ward which is available. We only lack human resources. So once that one is done, we are going to increase our capacity. And I wanted to say that we have also started highly specialized clinics, and we will introduce more. We were not there before, we are going to introduce more. And it is our desire to train our young mental health workers in the highly specialized care services, so that we offer that tertiary care service that is required. Madam CS representative in the hospital is available to give capacity building and technical assistance to counties, and we will request your office through a policy direction that the counties also, those which are not offering mental health services, they start doing so, and we are available to walk them through so that we have these services available. I'm sorry for speaking a lot, but I wanted the team to know what we are celebrating. We have so many achievements, I can't list all of them, that we are celebrating today. And those achievements have been made possible by this staff we are seeing here. We are not enough, but they are planning tremendous work. With those few remarks, or many remarks, I want to welcome you all to join us in celebrating 120 years of experience. And as you go, remember we do one thing: healing minds to restore life and touch families. And the supporters, our partners to realize that. Thank you so much.
Thank you very much indeed. Let us give Bwana CEO Dr. Julius Ogato another round of applause, ladies and gentlemen. Without even adding